I call this meeting to order. Bonjour et bienvenue, tout le monde. Bonne année. Happy New Year, everyone. Good to see you here this afternoon, and also very warmest welcome to our witnesses for this afternoon. I'm going to kind of break with a little of tradition. Normally, I scale down my opening remarks and the direction that we've gotten from the House of Commons. But because this is our first session in this new year, there's new technology and new procedures. I'm actually going to do the entire thing. And then from here on, then I'll just go back and use my shortened version. All right. But there are some important changes included in the direction that we've received today from the House of Commons. So, la réunion aujourd'hui se déroule sous forme hybride, conforme à l'ordre.
Today's meeting will take place in hybrid form, pursuant to the order adopted on January 25th, 2020. Members will be attending either in person or over Zoom. Discussions will be posted on the House of Commons website. For your information, web broadcasting always shows the person speaking rather than the entire committee group.
We're in this new webinar format. They are public committee meetings. I'm hoping that your sign-in process was a little quicker than normal. I was really happy for the extra help from our translators to make sure that all of our equipment was working and that translation is going to work well today. So there's also staff are on, but they are non-active participants and they can view the meeting in gallery view. There is one thing that they asked us to remind you, and that screenshots and taking photos of your screen is not allowed. It's not permitted. So anyway, just as a reminder, we are going to follow the health authorities' guidelines that have been put into space here, whether it's distancing, whether it's masks. We're allowed to take off our mask when we're sitting, but if we get up to move around, then we must replace our mask and using all of the proper hygiene. So I just ask that you all, those of you who are here with us in person today, adhere to those measures. Members and witnesses may speak in the official language of their choice, and we have some terrific interpreters with us here today. You have the choice at the bottom of your screen, floor, English or French. You don't need to switch between different languages now. If you're going to speak some in French and some in English, the system will automatically switch for you. And you'll also notice that the raise hand feature is now more easily accessed location on the main toolbar, should you want to speak or alert me for something, okay? So please, before you start speaking, wait to be acknowledged. It's all about having to make Zoom work for us better. And you know how to unmute yourself. Where after all these months, I still find myself having to remind myself to unmute the microphone. Isn't that awful? Yeah. All those comments and questions should be addressed through the chair. And if you would try and speak very clearly and not as quickly as I tend to speak sometimes, it actually makes the job of our interpreters difficult when we speak really quickly. So we're going to try and keep a consolidated order of questioning. We've got from each party who their members and what order they're going to speak, and we're going to try and be adhere to that as much as we possibly can. We are today resuming our study of the impact of COVID-19 pandemic on Canadian Armed Forces operations. And today, we are very lucky to have two very sought-after witnesses with us here today to help us. We have Major General Danny Fortin, Vice President, Vaccine Rollout Task Force, Logistics and Operations at the Public Health Agency of Canada, and also Major General Mark Meisner, Acting Chief of Staff Operations, Canadian Joint Operations Command. So we thank you, witnesses. We know, we understand just how valuable your time is, and we are very grateful that you can be with us today. So I'm going to allow each of our witnesses a 10-minute opening statement, and then after the two statements are done, and then we will proceed with rounds of questions. And with that, I would like to welcome Major General Danny Fortin to address the committee. Welcome, General Fortin, and thank you for your time.
Madam Chair, thank you very much. Thank you for inviting me to discuss the role that my team and I have been playing in the whole of government response to COVID-19 pandemic. I am Major General Danny Fortin, and as you mentioned, I'm the Vice President of the Vaccine Rollout Task Force, Logistics and Operations at the Public Health Agency of Canada, and responsible for the oversight of the distribution of COVID-19 vaccines to Canadians. The distribution of COVID-19 vaccines on a national scale is an operation of unprecedented proportion. It became evident early on in the procurement process, and as the Government of Canada was identifying vaccine candidates, that the early-to-market mRNA COVID-19 vaccines would have unique handling and storing requirements that would necessitate novel, fit-for-purpose logistical solutions outside the scope of Canada's usual immunization programs. The particular suite of challenges posed by these novel vaccines lends itself well to CAF organizational skill sets managing complex large-scale operations, particularly when complemented by the scientific and immunization expertise within the public health domain to form an interdisciplinary team to guide the distribution of many million vaccines across the nation. By way of context for Canadian Armed Forces and Department of National Defense augmentation to the Public Health Agency, the team has been operating in its current configuration since November. But the Canadian Armed Force and Department of National Defense augmentation to the agency goes back over 10 months. Over the spring and summer months, March to August, a team of CAF members supported efforts to develop the warehousing and distribution contracts for Canada's large-scale PPE orders. Early in the fall, additional CAF members and DND personnel were brought in to bolster planning and coordination capacity at the agency and contribute to the creation of a dedicated vaccine rollout task force. The Vaccine Logistics Planning Team and the National Operations Center for Vaccines advance party preceded my November arrival by about a month. My team at the agency currently has 52 personnel. It includes logistics experts, operational medical planners and specialists, information technology and systems experts, contracting experts, and a communications team to prepare me for the engagements. It is focused on all dimensions of COVID-19 vaccine distribution planning, including ancillary supplies and the cold chain enabling equipment, as well as the running of the Vaccine Rollout National Operations Center, the central coordination hub for the distribution of COVID-19 vaccines to provinces and territories, as well as to federal jurisdictions. The mandate of the National Operations Center includes the coordination of vaccine orders from federal, provincial, and territorial partners to the manufacturers, the coordination of the federal logistics service provider for the transport and distribution of vaccines to vaccine delivery sites across Canada as identified by provinces and territories, coordination of delivery of ancillary supplies and enabling equipment from the agency's National Emergency Strategic Stockpile, and ensuring the timely and transparent communication between partners and stakeholders, including vaccine manufacturers and logistics service providers, is maintained to enable efficient operations. The team's work revolves around the planning and coordination of the practical aspects of the COVID-19 vaccine distribution. Throughout November and December, and now into January, we implemented a deliberate and phased approach to COVID-19 vaccine readiness. This provided us with the opportunity to assess and begin scaling up the cold chain capacity across the country and to roll out the training, ancillary, and enabling equipment. My team helped strengthen the distribution plan by introducing risk mitigation tools. Through a series of established exercises and rehearsals, we collectively stress tested the vaccine distribution plans, verified their effectiveness, identified the challenges, and established contingency plans. In light of the unique cold chain requirements of both Pfizer, BioNTech, and Moderna vaccines, this approach ensured that the initial capacity to receive, store, and administer vaccines at the provincial and territorial level was appropriate for the limited supply expected in phase one, or the first quarter. These efforts culminated in an early vaccine rollout mid-December. Our planning and execution at every step has been done in close collaboration with all stakeholders, federal, provincial, territorial, and Indigenous partners, as well as the industry stakeholders, to ensure that vaccines continue to be delivered efficiently and safely to all regions in Canada. The quantity of doses arriving in Canada will continue to grow. We expect the shipments from Pfizer BioNTech will accelerate in the latter half of February and through March to reach their Q1 commitment of 4 million doses. We also expect over 1 million doses of Moderna in March to reach their commitment of 2 million doses by March 31st. This will set the stage for the large-scale ramp-up we anticipate in the second quarter of 20 million doses of approved vaccines, with the potential of even more as additional vaccine candidates are authorized by the regulators at Health Canada and supply becomes available. We are working to build capacity within the Public Health Agency of Canada and to support efforts across the provinces and territories to ensure the success of Canada's COVID-19 immunization campaign and to set the conditions for more robust institutional capacity to face future pandemics. While we focus on this mission, we're working to identify key capabilities and functions currently being provided by Canadian Armed Forces and Department of National Defense members on the team so that appropriate human resource planning can occur at the agency to ensure the continuity of COVID-19 vaccine distribution to Canadians. In conclusion, the CAF members and DND personnel assigned to this mission are proud and humbled to be part of this whole nation effort to support Canada's COVID-19 immunization strategy. With that, thank you very much, and I will now hand it over to General Meisner.
Thank you. Thank you very much, General Fortin and General Meisner.
Madame la Présidente, je vous remercie de me donner.
Madam Speaker, I'm very pleased to have the opportunity to appear before this committee to explain the role of CJOC and how it contributes to the pandemic response.
The Chief of Staff to the Commander of the Canadian Joint Operations Command. I will focus my remarks today on how the CAF operates to support this whole of government plan, the role of CJOC in this operation, and our support to the COVID-19 vaccination plan. At CJOC, we are responsible for the command and control of Canadian Armed Forces operations, whether domestic or international. In that sense, we are the action arm for the Canadian Armed Forces COVID-19 response, as we support the government in delivering on the support requested from federal, provincial, and territorial governments. This also includes the planning needed to undertake these operations. In close collaboration with the Public Health Agency, the Canadian Armed Forces initiated Operation Vector, our support to Canada's vaccine distribution. There are three key components to this operation. Supporting Public Health Agency with planning assistance. This includes support to the National Operations Center, the warehousing of PPE and equipment, and supporting provinces and territories with planning, and if required and requested, assisting the provinces with their own vaccine distribution plans. Maintaining a robust ready force comprising sea, land, and air force elements. These elements also support other government departments in order to streamline communications integral to all government contingency plans. And thirdly, vaccinating our own CAF members as our allocations are provided, including our members deployed overseas. Dans le cadre de l'opération Vector, planifiée par les
As part of Operation Vector, it is important that the personnel assigned thereto are able to carry out their tasks, both to minimize moving around in communities and to take advantage of their deeper understanding of the local situation on the ground. Operation Vector maximizes the use of our reserve forces and the Canadian Rangers in order to respond to the demand and to allow people to move around as little as possible and to, in that way, contain the spread of the virus.
Range from assisting with planning and coordinating the transport, storage, and distribution of vaccines to assisting local communities with setting up vaccination clinics. To date, we have seen requests to move equipment, such as the transportation of freezers to the territories in the north, and in preparation for the receipt of the vaccine, assisting in the transportation of Canadians in remote parts of our country to vaccine clinics, as well as assisting the setup of vaccine clinics themselves. As for vaccinations for CAF members, we've already received an initial allocation of vaccines for our military healthcare workers and are fully part of the national plan. As the availability of vaccines in Canada ramps up, the CAF will conduct our internal vaccination plan to ensure our members are safe, better prepared to operate in the COVID environment, and will not transmit the virus to the Canadian population at home or our allies and partners abroad. Les FAC ont soutenu les
CAF has supported Canadians during the pandemic and remain ready to do their part. Assigned to along with other departments and partners.
Of Operation Laser, the Canadian Armed Forces is currently providing vital assistance and care to northern and isolated communities. The Canadian Rangers are also continue to be active across Canada, providing assistance to northern and Indigenous communities as required. Madame la Présidente, membres du comité.
Madam Chair, committee members, I will now be pleased to take any of your questions. Thank you.
All right. Well, thank you very much for that, General Meisner. And with that, we will start our rounds of questions with Mr. Bazan, please.
Thank you, Madam Chair, and I want to thank our witnesses, General Fortin, General Meisner, for the incredible work that you're both doing on battling COVID across this country. There's no question in my mind that the rollout of this vaccine and dealing with this pandemic would not be possible with the brave men and women of the Canadian Armed Forces. The skill set that you guys bring to the job, command, the control, the leadership, and the delivery of services is bar none the best in the world. And just please pass on our thanks and gratitude to all the members of the Canadian Armed Forces. Whether they're working on Operation Laser, whether they're working on Operation Vector, or they're deployed overseas, or they're standing ready here at home, they're all doing their part to keep all of us safe. General Meisner, you were talking about our troops and they're getting vaccinated. We heard reports earlier this week, 250 members of the Canadian Armed Forces in the last month have become infected with COVID-19. Can you tell us quickly on whether or not they became ill through community exposure, whether it was in services in long-term care homes or helping our Indigenous population during more northern communities, or were they deployed overseas and became infected through that stage? And also, I hope each and every one of them have been able to recover from their illness.
Madam Chair, thank you very much for the question, and thank you as well for the well wishes, which we will pass on to, or I will pass on to the members of the Canadian Armed Forces. In response to the question, obviously the health and welfare is very important. The health and welfare security of our members is very important. We follow PHMs, and we definitely take advice from the Surgeon General and our command surgeon as we implement not only our public health measures but our layered risk mitigation measures. So, in response to your question, we have a very low percentage of actually people that have contracted COVID-19 compared to the general population. And I can confirm that from the information I know, that it's mainly been through close contacts of family members and things like that, and less so in the conducting their duties.
Okay. Thank you, General. I appreciate that. And again, please pass on our best wishes to everyone that they have a quick and speedy recovery. And I know that some of our colleagues are probably going to ask you questions about vaccinating our troops before they deploy, but I do want to come to General Fortin and the issues surrounding vaccine availability. You're on the news yesterday and talking about the complications in doing vaccine distribution across this country as part of Operation Vector because of the reductions of supply coming from Pfizer. Today, we learned that Moderna has now also decreased supply. So the Pfizer reduction puts us behind schedule by the end of February. My numbers I'm reading in the news is 845,000 vaccines short. Now with the Moderna reduction, that's going to put us over $1 million behind, or 1 million doses behind the ball, behind the 8 ball. So General Fortin, how are you going to be able to provide that logistical support to the government who has been so inept at being able to get their hands on doses at the same rate as 20 plus other countries around the world who are way ahead of us in the vaccination process?
Madame la Présidente, merci beaucoup pour la question.
Madam Chair, thank you for the question.
To start off, I'd like to point out that the manufacturers are dealing with new products with challenging production challenges, and they are, and we can expect fluctuations in their production. We certainly have experienced a bump on the road with the recent reduction for a period of about 4 weeks in what we can hope to receive from Pfizer. Pfizer assured us that we are to receive 4 million doses by the end of March, and they continue to assure us of that. Moderna assures us that they will provide 2 million doses by the end of March. And as we get closer to that deadline, there's more and more pressure on all of us to provide the right quantities. I want to assure Canadians that we are working extremely hard with the manufacturers, with all the stakeholders, to have as efficient a rollout as possible. And we are dependent on what the manufacturers are able to produce with a new technology, a new type of vaccine in a global demand or global market that is putting pressures on everyone. So I remain committed to providing as clear a picture to Canadians and to this committee and other committees as to what we can expect and when, and work very closely with all stakeholders.
Thank you, General Fortin, and through the chair, I'll come back to you, General. And I guess that's the thing is the Canadians are looking for is the clarity. They're you saw some polling numbers today. They're getting more and more concerned about whether or not they're going to have access to these vaccines. As you just mentioned, that a lot of this is dependent upon manufacturers and the contracts we signed. We know that the Johnson vaccine is only shown to be 66% effective on one dose that was in the news in the last couple of days as well. Whether or not that receives approval by Health Canada is another issue. So on the projections, on trying to get to where the Prime Minister has said that all Canadians be vaccinated by September, is that dependent upon the ability of vaccine companies to deliver? And outside of Pfizer and Moderna, is that including any other manufacturers to provide vaccines to Canadians?
So, Madam Chair, thank you. So Canada has contracts with Pfizer, BioNTech, and Moderna for a total of 80 million doses this calendar year. So so right there with those two approved vaccines, we have sufficient quantities to vaccinate all Canadians that wish to get a vaccine.
That's as long as they all get delivered, because we do know that the EU, as the Americans are already talking, them first, us last. So, that's still contingent upon them providing vaccines without having reductions happen because of internal politics.
It's entirely dependent on us receiving vaccines. Absolutely. Now, despite the challenges, the immediate challenges, we expect to have 6 million doses by the end of this quarter, another 20 million of those two approved vaccines in the next quarter, which represents a significant jump, and that poses some challenges, and we're working through that with provinces. And in the summer, we can expect the larger chunk of the remaining 54 million doses. So our planning assumption is that 45 million will be made available for the summer into the early fall period. And that's why we are confident that based on those estimates, having received the majority of those 80 million approved vaccines, we will have sufficient quantities for all Canadians who want to get vaccinated, have access to a vaccine.
All right. Thank you very much. Oh, sorry. I was waiting for a natural break there. Thank you very much, Mr. Bazan. On to Mr. Baker, please.
Thank you very much, Chair, and thank you, General Fortin and General Meisner, for being with us here today. And I'd like to extend my thanks on behalf of my community and my caucus for your service, particularly at this critical time during COVID-19, as you help Canada fight COVID-19 through vaccination, through Operation Laser, in a number of different ways. So thank you for that. Please pass that along to your teams as well, if you would. I'd like to return to an issue that is close to my heart, close to many people in my community, I think close to many Canadians, and that's the issue of long-term care. And I think I'll direct my question to General Meisner at first. In the Etobicoke Centre, in the community that I represent, we've lost 42 residents to COVID-19 at the Eatonville Long-Term Care Centre, and this is one of the homes where the Canadian Armed Forces personnel served in the spring. So first of all, I'd like to once again extend my thanks to the Armed Forces for serving in long-term care homes, all of the long-term care homes that personnel served in, but particularly those CAF members who cared for and saved lives of constituents in my community in Etobicoke Centre. And I'd also like to thank the CAF for preparing the report that was prepared and made public, describing horrific and abusive conditions at a number of long-term care homes where they were posted. And I think that report is important because it enabled awareness, which has led to advocacy and the federal government committing to national standards for long-term care. And when implemented, this will make a difference for generations of seniors. The current situation, however, is dire. So despite the above service that I've talked about, despite the attention that's been given to long-term care during the first wave, not enough was done. And I'll speak about the context in Ontario to learn the lessons from the first wave of the pandemic and protect our seniors during the second wave. So COVID-19 in Ontario right now, approximately 256 long-term care homes, that's 41% of all long-term care homes in the province, are in outbreak. And Ontario public health authorities project that more residents are projected to die of COVID-19 in the second wave of the pandemic than the first. And to me, this is beyond reprehensible. The lack of action to protect our seniors in long-term care, given what we knew from the first wave and the second wave, is beyond reprehensible. And of course, the Ontario government, it's also disappointing to me that the Ontario government has refused to work with the federal government and other provinces on national standards for long-term care, because to me, this is the only way to ensure that over the long term, that seniors in long-term care get the care that they deserve and address the issues that were raised in the report prepared by the Canadian Armed Forces. So my question, General Meisner, to you is, to your knowledge, has the Ontario government requested assistance from the CAF, from the Canadian Armed Forces, to help in long-term care during the second wave of the pandemic?
You're not coming through.
Madam Chair, thank you very much for the question, and I'll just begin by acknowledging that many people are suffering in COVID, and especially in long-term care facilities, and that and I guess welcoming or thanking the speaker for the comments on the Canadian Armed Forces contributions to long-term care facilities during Wave 1. Um, in response to your question, the Canadian Armed Forces, we're ready to respond wherever and whenever the government needs us to help protect Canadians. The defense team is part of a national response to help minimize the impacts of the pandemic. In a crisis, when civilian capacities are overwhelmed and the CAF are called to assist, we do so in support of civilian authorities to help stabilize the situation in the shorter term, providing time for resources to be put in place as necessary by civil authorities. We're capable of conducting simultaneous operations, including responding to COVID-19 and natural disasters, as well as other activities necessary for the defense of Canada and its interests. We continue with our critical tasks right now, such as training, recruiting, operations, and we are prioritizing our efforts to ensure we're prepared to provide assistance when asked. The CAF, as a force, resource, and trained for its military role in defense of Canada, are able to support civilian authorities when general duties, as well as to provide certain specialized capabilities if and when required. That said, our resources are finite, and CAF assistance is prioritized and managed in scale, scope, and duration in close collaboration with federal, provincial, and territorial partners. And meanwhile, we rigorously apply public health measures and risk mitigation measures as we implement them. To date, I guess in response to your question, we haven't received a direct request to support Ontario in long-term care facilities, but we are very closely coordinated within our regional joint task forces with the planning that is happening with respect to the response to the COVID distribution, and are providing support to Ontario in other areas, including in support to their distribution plan for northern and isolated communities.
All right, thank you.
General.
Thank you, Mr. Baker. On to Monsieur Brunel-Duceppe, s'il vous plaît.
Monsieur Brunel-Duceppe. Thank you, Madam Chair. I would like to thank Major Generals Fortin and Meisner. And I imagine that you are working very diligently every day, day in and day out. And I'd like to thank you once again for Operation Laser. And as Mr. Baker said so well, I'd like to speak about your report on the national standards for long-term care. You might remember that there are standards, but they were not respected by the labor force, and that proves that the health transfers to provinces must be increased. So that's the first thing. I'd like to ask you, how many vaccine doses have been delivered by the CAF to Quebec? Madam Chair, thank you for the question. We have delivered to date over 1.1 million doses of Pfizer and Moderna vaccine. The vaccine is distributed to certain areas that are designated by the provinces and territories, and they choose the pace at which the vaccine is rolled out according to their own immunization plan. Thank you. Thank you for the answer. I imagine that you have a sort of week-by-week plan for the distribution of vaccine. Is that correct? Madam Chair, yes, we do have a distribution plan, a rollout plan. the Moderna vaccine is currently coming to us every 3 weeks, and it's distributed in close collaboration with the provinces and territories. Yes, excellent. So I imagine, as Mr. Bazan said, that the announcements that we've heard recently must have impacted, must have delayed the distribution, I imagine, in your week-by-week plan. Is that correct? Yes, it's a 4-week delay for Pfizer, and Pfizer has reassured us that we will receive the amounts that were scheduled, but we know that other countries are affected as well because of this delay. The news from Moderna is a new change, and that we're talking about a reduction of some 20% with regard to what was planned. Now, in your distribution plan, did you plan in a sort of buffer, for example, to provide for possible delays? Madam Chair, when we devise our plans, we put in place numerous risk mitigation measures. So we looked at a host of factors. For example, a production site or a warehouse that might be required. Now, we had not planned for such a considerable impact with the announcement of Pfizer. 4 weeks was not planned. That is a significant short-term impact, and it is very disappointing, definitely, with regard to the clinics. However, all indications point to the fact that we will be capable of significantly increasing rollout over the coming weeks. Question. So you are optimistic then that at the end of the day there won't be any major impact given Pfizer's promises. Is that correct? Madam Chair, I am optimistic, but only rather in a measured fashion. Now, with regard to the provincial plans, they were based on what the federal government was going to deliver in terms of vaccines, correct? Madam Chair, yes. That's the result of a great deal of coordination between the provinces and territories and the federal government. What is important to indicate here is that the provinces and territories are used to preserving vaccines at between 2 and 8 degrees with their own distribution systems and the pharmacies and private clinics. However, the vaccines that have currently been approved are completely new and they have very particular requirements. And we're trying to centralize our efforts in terms of purchasing power and distribution. And the provinces are urged to coordinate their own plans. And I also encourage the provinces to use what the federal government can give them in terms of rollout capacity. Well, yes, so I imagine that this is gigantic in terms of a coordination effort. We've never seen anything like it. So once again, I'd like to commend you on all the work you're doing. This is new. You built this plan from scratch. And so once again, I'd like to congratulate you. So with regard to coordination efforts, that means that provinces are aware of your distribution plan, your rollout plan, because I imagine that you have worked with them on this. Is that correct? Madam Chair, we have very frequent discussions and daily written communications with the provinces and territories, and we regularly share our distribution plan with them. Now, with the data that is fairly clear from the manufacturers and the planning data that is used, well, we have to use it with a grain of salt. Things can change, as we have learned once again today. Thank you very much. Thank you. Thank you.
Thank you very much, Madam Chair. And I want to join my colleagues in thanking the Canadian Forces for the contribution they've made in the fight against the COVID pandemic, and in particular for the assistance they provided in long-term care homes in Quebec, Ontario, and Manitoba, and of course to General Fortin's team in the distribution of vaccines. I want to start with a question to General Fortin, but I want to make some remarks about the context to keep myself from asking him would have, could have, should have questions, which are clearly beyond his wheelhouse. But we're in a situation where Canada lost the capacity to produce vaccines in Canada due to decisions of governments that precede this one. We're also in a situation where we have not provided as strong support for research and development as we could have provided for vaccine development in Canada. And finally, there were discussions last summer about the contracts we were negotiating, whether they would include the right to produce vaccines in Canada or a condition that some of the vaccine be produced in Canada. The Prime Minister was talking about that in August and then walked that back in November. So I don't want to ask about any of those things to General Fortin. What I want to ask about is our relationship to the pharmaceutical companies providing the vaccine. This morning, AstraZeneca released highly redacted versions of its contract with the EU. And that contract says that they will make best reasonable efforts to provide vaccine in the quantities in the contract. So, General Ford, your understanding of these contracts, that they are contracts for delivery of vaccines by a certain date, or that they are contracts only for best reasonable efforts to deliver vaccines?
Madam Chair, thank you very much for the question. It is a complicated answer. First, I cannot answer in sufficient detail the issues of procurement. What I work with is the vaccines that have been approved, we have contracts for, and I know are coming to Canada. So that is really my wheelhouse, coordinating the distribution. What I can tell you is that we have agreements with, Canada has agreements with 7 manufacturers. The approval for the remaining 5 are at different stages. I am not tracking the detail of the contractual arrangements. That would be a question for procurement.
And so you're in the situation of simply getting notices from the vaccine manufacturers of what they will provide by a certain date, and then dealing with those notices. We don't really have any recourse under these contracts other than to accept what is promised on whatever dates they're promised.
Well, Madam Chair, we have those discussions are very much continuous. We have discussions often with the manufacturers on the detail of the shipping for the immediate and the midterm. We also have discussions at the tables where Procurement Canada is also in a position to discuss their own areas of responsibility with the manufacturers. So it's a joint effort. My team, myself, really focus on what's been contracted, what's in the first quarter for this instance. We have planning figures for the next quarter. As those manufacturers experience the expected challenges and fluctuations in production, they constantly keep us informed, and we have to go with information that they provide us with the full expectation that they're being as transparent as they can be.
Of course, you do have my full sympathies in the difficult situation you're dealing with there, but I think everyone will understand why members of Parliament are concerned that these aren't contracts in the normal sense of the word, and certainly the president of AstraZeneca said they're not, that they are contracts for reasonable efforts, and they're not actually contracts for delivery, and that leaves Canada in a very vulnerable situation. Let me turn to another aspect of that, and that is where the vaccines are coming from. There have been, certainly Pfizer is producing in the United States and in Belgium, and there have been indications from both the United States and from the EU that they may possibly wish to limit exports of those vaccines. So in those discussions, are we having any discussions about where the vaccines are being produced at this point, given the threats to disrupt distribution of vaccines by the US and the EU?
Madam Chair, I can comment to the vaccines that are currently approved. They are produced in Europe, and they're shipped from Europe to Canada through various means. There are some of those products that are also manufactured in the U.S. and other locations. At the current time, the U.S. production is aimed at the U.S. market. The Minister Anand at the PSPC is very much engaged, as she has indicated a number of times, with the manufacturers to bring forward quantities into earlier quarters, and also look at diversifying as much as possible the point from where those vaccines come from to reduce the risk. I think we're all very focused on what we learned this week from the EU, the executive order in the US, and what that could mean. And there's a number of variables at play here, and they're all being considered to the best of our ability.
All right. Thank you very much.
Thank you very much.
On to Mr. Dowdle, please. Sorry, you must be on mute.
There you go. Can you hear me now? Hello?
Yes, we can. Thank you.
Okay. Thank you, Madam Chair. I want to take the opportunity as well. I want to thank General Fortin and General Eisner for their dedication, commitment to this great country of ours. I read this morning a report that came out from the Angus Reid poll that showed basically that Canadians' confidence in the government's vaccine plan had declined 58% to 45% in the past 6 weeks, and that's certainly not a positive trend, and we need to do better. But just 36% of Canadians now say they feel the federal government has done a good job in securing sufficient doses for the population, and that's down 11 points from December. And while the number that says not so good has more than doubled. So, General, I certainly don't envy the position that you are in, and I have every confidence in your ability, and I certainly have more than enough confidence in the men and women of our Canadian Armed Forces to deliver every vaccine to which you are provided. And I'm very proud that to represent CFB board, which is in my riding. So I had a few comments here that I've heard from some other individuals here talking about long-term care homes, and I have a bad breakout in Barrie just beside me, the next riding over, and one in Bradford as well. And certainly the conditions aren't the great. I think we learned that over our studies to show that we can improve upon our seniors home. But there's one thing we can do, and we can do now, and to help these people. And really the onus is, instead of blaming others, we need to have a mirror and look at ourselves. We need vaccines for these people. We can deal with those issues later. So that's number one. But my question comes to the calls that I've received this week, quite a few, because of the area that I'm representing. There's concern. A lot of the frontline workers, the nurses, whoever is working in the seniors home, some of them have received their first vaccine dose, and now they're waiting for their second. So my question would be, with these backups that we're seeing here today, do you know how many people now are waiting for that second dose? And then the follow-up question would be, General, is there a plan how we're going to deal with the fact that perhaps over that time period that people are supposed to get the vaccine, if it goes past that point in time, will that change your whole rollout of how you're going to get the vaccines out to people? Because they'd almost be obsolete, perhaps. So I'm just curious if you could give me some insight into that.
Madam Chair, so I understand that the immunization programs in provinces and territories depend on the supplies, and we do everything we can to bring supplies in country. There is no strategic reserve. There's no pool of vials or vaccine doses that we're holding on to cater for shortages in one particular area faster than another, to ensure that we don't have a gap between the first and second dose that's beyond what the National Advisory Committee on Immunization has issued in terms of guidance. So all doses arrive in country are pushed as effectively as possible, as rapidly as possible, to provinces and territories who administer their own immunization programs. As to how many are waiting for their second dose, in a particular province or a particular jurisdiction. I can't really comment to that. That would have to be asked to the province of Ontario in the case of the member. But what I can tell you is that on the Canada.ca portal, there's a breakdown as provinces report on their immunization plan. There's a breakdown of how many people have been vaccinated, have received at least one dose, and we can go from there.
So basically, as it stands now, those individuals that do have that first shot aren't guaranteed the second shot in a timely manner. So they could be for not. So it would change the whole amount of vaccines we need. It would change the whole rollout of the plan. I know it's in conjunction with the provinces, but I think that's probably not only it's a huge issue to those individuals, but I think it's a huge issue logistically.
Madam Chair, I understand the concern for sure, and that's very much looked at in detail in terms of our projections. But as by 15 February, we'll have a significant increase in quantities and moving forward in terms of Pfizer shipments. We expect that the provinces will be able to manage that and stick to the NACI recommendation for up to 42 days interval. And specific problems can be flagged by provinces, and we can see how we can readjust. It's a zero-sum game, so we'll have to shift from one jurisdiction to another prior to arrival to ensure that we don't find ourselves in a situation where we have an extended period without the second vaccine. But that is something that the CMHOs and the CPH, the Dr. Tam's office federally is also looking at, but really the provincial and territorial medical health officers. The public health officers.
Thank you, General. So how many doses did we actually receive this week?
Madam Chair, this week we received 0 doses.
And just to follow up, how many doses should we be expecting next week?
Madam Chair, next week we expect to receive 79,000 doses of Pfizer product, as I announced on. I announced yesterday at the press conference, and we now expect to receive, starting in the latter half of next week, 180,000 doses of Moderna that will be distributed over the coming days through to the 9th of February 9th across the country.
All right, thank you very much. Monsieur Robillard, s'il vous plaît.
Oui, merci, Madame la Présidente.
Thank you, Madam Chair. I would very much like to thank both of the witnesses. And please convey my thanks to your personnel for Operation Laser. Major General Fortin, the Public Health Agency is aware of the importance of providing the vaccine to the Canadians in a timely fashion. What kind of logistical assets have you put in place for the distribution of the vaccine? Thank you. Madam Chair, thank you very much for the question. Obviously, the Public Health Agency is not usually tasked with administering such a large supply of vaccine across the country. So currently, it is coordinating the administration, for example, of numerous vaccines, including that for the flu. These are vaccines that are easier to distribute, and handling them is much easier because they are refrigerated rather than frozen. Now, the logistical challenges are considerable in this unprecedented type of operation. We're talking about winter, a vast country with remote communities, and the Indigenous communities are scattered across the country as well. So we're trying to do so to work as effectively as possible, and that is where the CAF has an organizational capacity, and it's easy for us to integrate with other teams. We've been working for many months now with the agency, so we've been able to team up with the agency and enhance its capacity. But it's really our expertise that has been added on to the complex operations that the Public Health Agency's team carries out along with its other partners. And that is why we are proud of this whole-of-nation approach that we're taking to manage this vast project. Major General Fortin, our government and the Public Health Agency have been transparent concerning the rollout of vaccines from the very beginning. I'm thinking, for example, of the weekly vaccination schedule. Do you know of any other countries who provide such calendars to their governments? Madam Chair, I'm not aware of any other countries that distribute their weekly calendars in terms of the rollout. And it is not part of my mandate to ask such questions. Thank you. Major General Meisner, what is the working relationship between the CAF, the Public Health Agency of Canada, and the provinces and territories, and as well as the Public Service and Procurement Department of Canada?
Yeah. You're not coming through.
Merci pour la question.
Thank you for the question, Madam Chair.
In English, so the relationship between public health agency and the Canadian Armed Forces is a very close relationship, as I think hopefully you've heard from Major General Fortin and I. We are closely coordinating with and supporting the Public Health Agency's plan. With respect to the relationships between the provinces and territories, you've heard Major General Fortin talk about the relationship between Public Health Agency and the provinces and territories. In parallel, the Canadian Armed Forces, through the regional joint task forces that are arrayed across Canada, maintain close relationships and planning support to the provinces where we are joined up with their vaccine distribution task forces to support their actions. And so there's great relationships, there's great collaboration, and there's great planning ongoing, so that we're aware of what they are doing, and if required and requested, able to support what they ask from us. With respect to our relationship with PSPC, I think it's really more linked to the Public Health Agency of Canada, and really outside of my operational focus from a Canadian Joint Operations Command perspective.
All right, merci beaucoup. Oh,
Merci.
merci beaucoup. Monsieur Brunel-Duceppe, s'il vous plaît.
Mr. Brunel-Duceppe. Madam Chair, I would just like to clarify some information. When Quebec made the decision to give more first doses, were you aware that there would be a delay in the shipment of vaccines? Thank you.
Madame la Présidente, merci beaucoup pour la question.
Madam Chair, thank you for the question. I think that Mr. Dowdell, I think you have to turn your mic off, please. Mr. Dowdell? I can hear you. Yes, thank you. Yes. So, from the outset, we discussed with the provinces and territories of the advantages and disadvantages of keeping back some of the first doses. We weren't sure of the forecasting in terms of shipments. Now, obviously, the delivery schedule with Pfizer changed over time. And so we tried to assume the appropriate risks with regard to our work with the provinces, because the provinces were the ones that were dealing with it. Now, we were not aware, and neither are we in a position to influence the decisions made by the provinces in terms of the first doses. Yes, no, I understand that. I just wanted to know whether, when they decided to roll out more first doses, if you knew that what was the situation of the vaccine, and you say no. Okay, that's fine. That's clarified. Thank you. Now you are telling us, and this is not your fault, it's Pfizer that fell down on its commitment, but you were talking about 0 doses this week. So what happens with Operation Vector, given that there are 0 doses distributed this week? What happens with the military personnel assigned to Operation Vector? Madam Chair, thank you very much for the question. I'm chuckling because part of my staff are working with in real time with the shipments, and others work from week to week. Now, within the Public Health Agency, we're trying to plan in a very detailed fashion how we are going to ramp up the distribution in the coming weeks. When we receive close to 1 million doses, how we can roll them out across the country as of April. So we have a great deal of work to make sure that we can position the freezers on the sites where they're planned to be. And this is in close collaboration with the provinces and territories. Excellent. Excellent. No, that's good, but those are the kind of questions we get from our constituents, so I'm very happy to be able to put them to you. Thank you very much. Thank you, Mr. Brunet-Duceppe. Mr. Garrison.
Thank you very much, Madam Chair. I have a question now for General Meisner. I was happy to hear that apparently those in the Canadian Forces who've contracted COVID have not done so in the workplace. And I raised some questions about this last November. DND has one of the highest rates of privatizations of service contracts anywhere in the federal government. About a third of the personnel costs in DND are private contractors. And quite often we have heard that those private contractors, the employees have less access to PPE, and they often have no sick leave or inadequate sick leave, forcing them quite often perhaps to go to work in order to keep food on the table when they should be staying at home. So I would like to ask the same question again. Have measures been taken to reduce the risk to Canadian Forces members and DND employees by the poorer provisions for those who are working on contract alongside them?
Madam Chair, thank you for the question. So I guess I would begin by saying that I just wanted to, I guess, clarify before. So before I said I wasn't sure, but yes, the majority of new CAF cases continue to be due to community recreational exposure or close contact with family members. And obviously, when that happens, CAF members in these cases have been observing appropriate public health measures, as they always are. With respect to, I guess I would say that again, you know, the Canadian Armed Forces takes the health and welfare of all its people very, very seriously, and you know, continuously follows PHM's, follows Surgeon General advice, and as the situation changes, adjusts the appropriate risk mitigation measures so that we are protecting our force, we call it, to accomplish our mission. With respect to specifically private contractors, all I can say is my experience is anywhere when you're in a D&D facility, PPE and appropriate PHMs are available. With respect to the sick leave portion of that, I don't have really very good visibility of that, and if you'd like, I could take that question on notice and come back to you in more detail on that. But again, you know, the defense team complete is carefully it, it is very carefully considered, and the health and welfare of that team is important.
Right.
Thank you, General Meisner.
Thank you.
And I would appreciate hearing back from you.
On to Mr. Benson, please.
Thanks, Madam Chair, and thanks to both of our witnesses for being here today. Major General Fortin, I was just online a few minutes ago reading a report. I just want to read a little bit of it to you. It says the European Commission on Friday, that's today, unveiled a mechanism authorizing member states to block exports of coronavirus vaccines from companies that have not met the delivery targets laid out in their advanced purchase agreements. The report goes on to say that this is alarming news for Canada and the UK. So it appears that our shortage of vaccines is going to continue for some time. This must be very frustrating to you, having set up this great group of people to distribute the vaccines all across Canada, and the logistics of having it all set up. And now we have no vaccines to distribute.
Madam Chair, thank you for the question. I think I would, not having read this media piece, I would point to the Prime Minister comment that he made earlier today. Prime Minister comment regarding his engagement earlier this week. And I would say that until further notice, I continue to plan closely with the manufacturers on receiving those vaccines on the dates they've indicated. And we're working through this in various, in addition to the Prime Minister engagements, various engagements are taking place to ensure that we receive our vaccines as planned.
Well, thank you. I don't think we're going to get them as quickly as the Prime Minister thinks, based on this other countries wanting to make sure that they have vaccines for their own citizens. Let's talk about the Prime Minister for a second. He said that one of the reasons he wanted CAF involved in this process was because of the possibility of some security threats to the distribution of COVID-19 across Canada. Can you give us an overview of what was perceived to be some of these security threats and what the CAF has done to mitigate or ensure that, if we did have the vaccines, that there would be no problems in their distribution?
Madam Chair, thank you. So I will not speak as on behalf of the CAF. I'll speak as the general that's working with the agency. I can tell you that we've identified with our partners, with the provinces and territories and federal stakeholders, potential risks in terms of cyber, risks in terms of misinformation, disinformation, physical risks to shipments, exports, and several other things for which we have mitigations. Others mitigations are continuous quest as we continue to adjust and share information appropriately. We have close coordination with law enforcement agencies because security remains a key consideration in our planning throughout for all vaccines, all forms of methods of delivery. And so we pay attention to all those things on a continuous basis. Law enforcement agencies and other services and agencies at federal down to the provincial, territorial, regional level are in close coordination to ensure that the appropriate actions are taken in anticipation of potential problems. As to specifics, I really can't go into specifics beyond that in the unclassified domain. But I want Canadians to rest assured that we're very much paying attention to the things that you would expect us to pay attention to.
Has there been any, up to this point, has there been any attack on the system? I get you can't tell us what you would do to stop it, because that's obviously, we don't want to give away any secrets in that way, but have there been any attempts so far to disrupt the system?
Madam Chair, I am not aware of any particular attack to in terms of cyber, but we continue to monitor those threats. As to potential specifics that would deal with law enforcement, that question would have to be asked to law enforcement enterprise.
Okay, well, thank you. One medical intelligence, you guys have a fantastic medical intelligence unit collecting information from around the world. And we now know that the more information we have and the quicker we react to it, the better we can deal with a pandemic like this. Do you have any thoughts on how that information that you're collecting should be better used in Canada to respond to a pandemic like this?
Madam Chair, I think the agency is poised to get as much clarity as possible on public health matters, public health risk, and public health intelligence. I really cannot speak to what the CAF is doing in terms of medical intelligence and what it provides to whom, but happy to take this question on notice and get back to the committee.
All right. Thank you very much. Mr. Spengeman, please.
Merci beaucoup, Madame la Présidente. Major Général Fortin, Major Général Meisner, merci de votre présence, de votre témoignage et également de votre service. Et j'aimerais aussi remercier les membres des Forces armées canadiennes sur votre commandement. Major Général Fortin, j'ai une question un peu plus précise.
Major General Fortin, I have a question on the role of your team with regards to risk management. Public Health Agency of Canada said that, and I quote, the armed forces personnel will strengthen risk mitigation and pre-deployment exercise tools, management tools. Regarding these risk management tools, could you give us some clarity? Are these mechanisms exclusively military mechanisms and tools, or how do these teams work on a daily basis?
Madam Chair, I believe that this question, if I understand the question, I believe that it affects the ongoing actions that are ensuring the high readiness levels for the provinces and territories. So I'd just like to make sure that I understood the question. Now, we have put in place a number of methods that lend themselves well to military operations and that we adapt to our team and our CAF/DND approach. And some of these methods are more based on military operations, but they are adaptable to non-traditional operations. So we put in place tabletop exercises, and we worked with more than 140 partners in December on these tabletop exercises, and we're preparing for the phase 2 of the ramp up. So we're going to have another opportunity to bring a number of these players back around the table and to discuss our plans and the adjustments that are required to be in a good state of preparation. Thank you very much, Major General. That was very useful.
Of trust in the Canadian forces, and my colleagues have made reference to the role that you've played in the operations with respect to COVID, but beyond that, Canadians trust the Canadian forces. Canadians also trust science and public health authorities. So from the very beginning, there's a strong understanding that the complementarity of these two teams really can add and does add tremendous value and essential value to the response to COVID-19. Either of you or both of you, could you tell us specifically what mechanisms are within your reach to protect the most vulnerable victims within this pandemic? Colleagues have made reference to seniors in long-term care, to Indigenous communities. There are other vulnerabilities that will come up depending on data, depending on demographics. How nimble is the mechanism, the cooperative integrated mechanism between PHAC and the Canadian forces with respect to supporting the most vulnerable in this pandemic?
Madam Chair, thank you for the question. I will start and I'll ask my colleague to complete the answer with what the CAF is doing in support along those lines. But I can tell you that the agency and my team integrated in the agency is very much following NACI guidance, following the the understanding of various tables and the discussions that come, the decisions or the guidance that come out of various tables, the Canadian Immunization Council, and the advice of a number of stakeholders. In the interest of time, I keep it short, but we factor that into it's factored into the agreed to distribution and the prioritization of who receives the vaccine in the provinces and territories, and then the provinces territories apply those this guidance. In terms of distribution, that set of the operation is agnostic to who receives the vaccine. We distribute, though, on a per capita basis that is adjusted for the remote indigenous areas, and it is adjusted so that in the first quarter, the population, the adult populations in the territories have access to vaccines. I think in terms of CAF, though, I'll have to turn to General Meisner.
Thank you, Madam Chair. I would just add a couple things, and I guess first of all, since the very beginning of the pandemic, the health and welfare of our people, of the defense team, has been a crucial part. And so, at the very beginning of this, anyone who had or identified that they had any vulnerabilities or any health conditions that could have been impacted were immediately, I guess, identified and made sure they were accommodated. In other words, not bringing them into additional risk areas and likely left at home to ensure their well-being. The second thing I would say, and it's similar to what Major General Fortin said in terms of vaccination, which is ongoing right now in the Canadian Armed Forces. Our priority one is to our frontline health care providers, but in addition, it's also to our folks who have health conditions that may make them vulnerable to severe forms of COVID-19. So they are at the very top priority of our receipt of vaccines.
Thank you very much. Merci beaucoup, Madame la Présidente.
Thank you very much. Madame Gallant, please.
To our witnesses, first of all, once I heard that General Fortin was in charge of the rollout of the vaccines and the distribution, I had absolute confidence. I knew that once you get the vaccines, they will get to where they need to be. And General Meisner, I don't know if you're aware of it, but we're blessed to have two Meisners in here today. One is your big sister doing interpretation, and we worked in Defense Committee with her before, and she's just a joy to have. Well, shortly after Christmas, we were deploying soldiers to Latvia, and there was a report that soldiers already there and scheduled to come home were suffering from COVID. This really upset the family members because they knew that their loved ones had not been vaccinated for COVID. What measures are being taken for these soldiers just getting into theater to protect them from those who may have already been infected from it?
Thank you, Madam Chair. I guess I would say that again, to reemphasize a number of my points about the importance of the health and welfare of our personnel, not only in terms of following public health measures, the advice from our Surgeon General, our command surgeon, who dives deep into each operation to understand the specific requirements of that operation, the layered risk mitigation measures that are put in place, the quarantine before people deploy, the special steps that are taken while they're deployed, and the post steps. I guess these are all the things that are happening to mitigate a very dynamic COVID situation, dynamic and evolving COVID situation, which we continue to monitor very closely. I can say with respect to that particular operation, we speak very regularly with the commander in theater, and the command team. They've done an amazing job to as have all of the command teams for our deployed forces to take the appropriate actions to mitigate any risks and support the health and welfare to our members. Concurrently, we're working with the force generators to ensure that as the situation changes, which often it does in a dynamic situation like this, the families are kept apprised of this of what is happening with their loved ones and kept informed, all in the best interest of the health and welfare of our folks, while obviously continuing to carry out our duties and tasks on operations, because in the end, that is what the Canadian Armed Forces does. It delivers on our missions. That's in a nutshell how we continue to manage this.
Thank you. Real quick question, just yes or no. Has Defense ever deployed CAF members to operations in nations with high cases of illnesses such as malaria or yellow fever without the member first receiving the proper vaccinations against those illnesses that you're aware of?
Thank you for the question, Madam Chair. I guess that would be unlikely, given our robust deployment or screening that happens before anybody deploys. So there is a robust screening mechanism that occurs before anybody deploys to an operation to ensure that all of those things I just talked about are factored into ensuring the member is ready for the operation.
Wonderful, thank you. Now, have any serology tests for COVID antibodies being conducted on the Canadian Armed Forces athletes who competed in the 2019 World Military Games in Wuhan, China during the early days of the outbreak?
Thank you for the question. I'll be very honest. That I don't have any any detailed knowledge of that, and so I think the best way to go about that would be to take that on notice, Madam Chair.
Okay, so do we know when the people in Latvia will be vaccinated, or are there any rapid tests available for people who are deployed overseas?
So as I've mentioned, we've commenced our COVID immunization campaign in order to reduce the threat to our members and maintain our operational effectiveness on our operations. Planning is ongoing for the vaccination of CAF members deployed outside of Canada. This planning is being done in coordination with multiple stakeholders to ensure that deployed CAF members are offered the vaccine as quickly as possible based on vaccine availability, the operational and logistics considerations, and the vaccine prioritization framework. So all to say that as soon as we can vaccinate these folks, we will, and CJOC is coming up with, or has come up with, a very detailed plan on how we will do it based on a number of factors.
All right, thank you very much. Mr. Bagnall, please. Oh, we need you to put on your headset, Mr. Bagnall.
Merci.
Sorry. I know that all 35 people on the call are very appreciative of the work of the Canadian military and keeping us safe. So thank you. And particularly, could you, for me, thank the lowest entry people who have just entered the military, who never expected to be they expected risk, but not necessarily this type of risk that they've been taking. So thank you very much. I'm the only member on the committee from the Arctic, from the North, so I'll be a bit parochial in my questions. But to let you know, the North really appreciates the tremendous job you have done and the Canada's doing in prioritizing the far North and remote Indigenous communities, because obviously they have no protection, they have no ventilators,
they really need it first. So we really appreciate everyone's sympathy for that. And they're just delighted, the elders and everyone just delighted that they're getting their vaccines now. Our health officers are delighted. And so thank you very much. And I don't know if you want to comment at all on the logistics of the North. I know that's pretty difficult, but anything you wanted to say related to that before I ask my next question?
Madam Chair, I would simply say that we have very good dialogue with the three territories, and they leverage to maximum extent what federally we can provide to facilitate their distribution plan and scale up over the coming weeks.
Thank you very much. And Major General Meisner, I just wonder if you have any information or could comment on particular planes that are used in the North, or any involvement of Joint Task Force North in the distribution of the vaccine.
Thank you, Madam Chair. So I guess I would say that like all of our joint task forces, Joint Task Force North is an integral part of CJOC structure. We're in touch with them very regularly and work with them very closely to ensure that their needs are met, and that we have great lines of communication, not only with them but also them with all of their partners that are supporting this effort. I guess the only other thing I would mention to that is that we as we support Joint Task Force North in providing any requests, we'll do that mainly through our amazing Canadian Rangers that are our eyes and ears on the ground and have done so much for us so far, and will continue to do so much moving forward, given their knowledge of the local situation.
Yes, I too would want to give a huge shout out to the Canadian Rangers for the work they always do. That be otherwise impossible in such a huge, unpopulated area. Major General Fortin, do you have any discussions with other nations on their distribution mechanisms?
Thank you, Madam Chair. Early on, as we started our work, I had the opportunity to engage with General Perna from Operation Warp Speed in the U.S. He's a 4-star general in the U.S. Army, and shared some considerations, learn of the differences, but also the similarities between what we were about to start, respectively, in our two countries. And we have also shared a few best practices, as we went forward into the recent weeks.
Madam Chair, is that how much time, or is that it?
No, I think that's just about it, Mr. Bagnall, unfortunately. Thank you very much.
That's fine, thank you.
Monsieur Brunel-Duceppe, s'il vous plaît.
And what? My turn? Yes. Thank you very much. This is my last question, and once again, I'd really like to thank you sincerely for all the work you do. It's truly appreciated. I'm going to put a question to you. Are you in communication, for example, with other countries as concerns distribution plans? For example, how does it work on their side, and do you make comparisons with how it's working in Canada so you can adopt best practices, for example?
Madame la Présidente.
Madam Chair, as I mentioned, I discussed things with General Perna. He's a 4-star general in the U.S. on Operation Warp Speed. And so, as concerns comparisons with these other countries, I haven't really had the opportunity to engage with other countries for now. That being said, our systems are quite different. We have 13 jurisdictions, and they come under the federal system, so it's a little bit different from country to country. But I'm certainly hoping to learn some lessons and compare at some point. Thank you very much, Major General Fortin. So let's talk more about international issues. I don't know whether this concerns you or not, but that's why we're here. Will the CAF be distributing COVID-19 vaccine as part of international humanitarian efforts? Or is that something separate? Thank you. Thank you, Madam Chair. I can perhaps begin first by saying that Canada is part of the COVAX initiative. So those doses may be shipped from Canada to other countries or from other countries to their destinations. So we are going to look at the tools that are at our disposal and to see how far the resources of the federal government will go. As concerns CAF, I'm going to have to hand this over to my colleague, Major General Meisner. Thank you, Madam Chair. So for us, our efforts abroad are focused on the personnel deployed abroad. And we want to make sure that we can support them in their operations. So that's really what our overseas operations are about. Thank you. Thank you once again. Thank you. Thank you, Mr. Garrison.
I want to return to the question of the threat to delivery of vaccine supplies based on where they're being produced. And of course, I think earlier what I implied was I would certainly like to see us restore our research and development and vaccine production capabilities in Canada. But in the short term, I think General Fortin, if I'm not mistaken, that the supplies of Moderna are being produced in Switzerland and therefore would not be subject to this possible threatened blockage by the EU. Is that correct?
Madam Chair, thank you. I can tell you that that information is in fact correct in terms of where Moderna produces. It's a global company, global manufacturer, but in Europe they produce the product that we are going to receive. I am told that they are manufactured in Switzerland, filled and packaged in Spain, and stored and distributed out of Belgium.
Thank you. I think there's some reassurance we can find in that, and when people refer to Europe, we maybe need to be a bit more specific. Also, I just want to confirm a feeling of reassurance. This morning, Novartis announced that it reached agreement with Pfizer to produce vaccine from their Swiss facilities by the second quarter of this year. And I'm just wondering if that might be a help to Canada, that we might be able to source the Pfizer vaccine starting in the second quarter from their Swiss agreement with Novartis, and therefore, again, mitigate the threat to the supply of vaccine in Canada.
Madam Chair, I would say that that's entirely possible. Pfizer BioNTech is a global manufacturer, and they have companies and sub companies around the world as to where that would be made, and if we could leverage that, or a company could leverage that to produce vaccines that are aimed for the Canadian market. I would have to refer to procurement, Public Service Procurement Canada for the details of that. But and Health Canada, if it changes anything with regards to regulatory approval.
All right. Thank you very much.
Thank you.
Mr. Bazan, please.
Thank you, Madam Chair. General Fortin, you've said a number of times that you're confident that Pfizer is going to live up to their contractual obligation to deliver 4 million vaccines to Canada. But yet, yesterday in the graphs that were provided, the provinces are only saying they're getting 3.5 million vaccines. Why that 500,000 vaccine discrepancy?
Madam Chair, I can certainly expand on that if given the time. What I would say is that the calculations at this particular juncture, where we are at an inflection point with the manufacturer, where Pfizer assures us that they will provide 4 million doses by 31 March. And
now, General, is that based upon 6 doses per vial or 5 doses per vial? And what happens if Health Canada doesn't approve that extra dose in each vial, especially in light of the fact that Manitoba, where I'm at, is saying that they only get 6 doses per vial 75% of the time?
Yes, I understand the challenge for sure. So again, Pfizer assures us that we'll get 4 million doses by end of March, full stop. How we're going to get there remains to be determined, because our calculations, until further notice, until Health Canada approves, assuming that Health Canada approves the 6 dose per vial, and when this would be implemented, will impact the quantities that we receive on a week-to-week basis. But the end goal of 31 March remains 4 million doses, and that's what Pfizer is working towards. As to 5 and 6 doses, I think that we'll see how it pans out as Health Canada is reviewing Pfizer's submission at this time.
And I hope they take in consideration that both Manitoba and I know Alberta, who've been trying to squeeze 6 doses per vial, haven't always got it 75% of the time. Are the contracts with Moderna and Pfizer binding, or do they have escape clauses if they fail to deliver?
Madam Chair, thank you. Unfortunately, I don't have that level of fidelity and that level of understanding of the specifics of the contract. That's very much with PSPC, although the agency, public health agency, is the client. I'd have to take this on notice and come back with a written answer.
Okay, shifting gears just slightly, General Fortin, in your early remarks, you said you have 52 members of the Canadian Armed Forces with you that have been seconded over to Public Health Agency Canada. I'm surprised that you didn't have anyone there, as earlier was you were asked by other members about anybody from either military police or from Canadian Forces Intelligence Command to deal with the potential of threat, either in the shipment of product coming to Canada, cyber, of course, as well as domestic possibilities of product getting diverted or stolen. So why don't you have that embedded with you in Public Health Agency Canada?
Yes, Madam Chair, that's a very good question. I think I would summarize it by saying that we are bolstering, with CAF members, bolstering capacity at the agency in the areas where we bring unique experience and capacity. For instance, organizing operations, the IT, the information technology. I have a medical advisor. I have a pharmacist that also advises me, communication team, and so on. In terms of military police, I would say that we leverage law enforcement, civilian law enforcement agencies and that enterprise, because that is not in the mandate of the military police to advise on civilian matters. In terms of intelligence, there's a clean demarcation where we leverage the non-military security enterprise to look at the different threat scenarios.
Okay, well, I would hope that from the Canadian Armed Forces, both from whether it's Canadian Forces intelligence or whether it's from military police, that on the international shipments, we did see, for example, PPE that was supposed to come to Canada that was diverted to the United States and other countries. Don't want to see that happen when the real scramble comes on who gets the vaccines as they're leaving and having planes diverted. So I'm hoping that there is some control and monitoring as well as presence on those shipments to ensure they arrive here in Canada.
All right. Thank you very much. On to Madame Vandenbeld, please.
Yes, thank you very much. I want to thank General Fortin and General Meisner for all of the work that you're doing, including the testimony here today, and through you, the entire defense team, in particular, those that are at the Public Health Agency of Canada, which is, of course, in my riding of Ottawa West Nepean. So thank you for that. General Fortin, I'd like to follow up on a comment that you made earlier, and correct me if I'm not quoting you correctly. But obviously, we know that CAF is incredibly well suited, both in terms of organizational capacity and skill sets for this kind of major operation. And you had said that you urge the provinces to use the federal coordination capacity. Do you have any indication that there are provinces that may not be asking for or using the full capability that the CAF has to offer?
Madam Chair, thank you very much. That's not totally what I meant, so I may not have expressed myself properly. What I meant is not so much the CAF capability, but what we at the agency have been able to brought to bear to distribute at scale. For instance, companies like the logistics service provider, joint enterprise, FedEx, and Innomar that Canada has a contract with to distribute all vaccines but Pfizer BioNTech. They are a legit, robust transportation shipping company with with experience and expertise with pharmaceuticals. So they are distributing across the country to points of delivery that provinces and territories have identified. Some provinces and territories wish to have more and leverage that more. Others prefer to have a mix of what they have in terms of their own system and leverage the federal contract. And we'll continue to encourage where they identify gaps or they identify risk areas, particularly as we scale up with millions of vaccines per quarter, to leverage to maximum extent what we can do with the federal contract and subcontractors that are controlled by FedEx and Omar.
Thank you so much for that clarification. I note that there were Canadian Armed Forces personnel in the Public Health Agency of Canada even early this spring. I made a visit there with the Prime Minister and had a chance to speak with some of them. So if you could talk about the long-term presence since the beginning of this pandemic of CAF with the Public Health Agency of Canada, the ability to embed and coordinate well with them, and the specific kinds of work that you're doing, particularly in terms of advanced planning. For instance, when did the planning start for this particular rollout of vaccine, and what are you doing now in terms of the planning for when we do start to receive those 20 million doses in the second quarter that you referred to?
Madam Chair, thank you very much. I don't think I'll have enough time to sufficiently get to the bottom of what we do every day, but I'll tell you, we can be very proud of the work that the team has been doing. Since back in the winter, the agency realized the size, scope, and the impact of the pandemic as we went forward. The example is with measures and assistance that the CAF provided at the agency in terms of accounting for receiving and distributing the PPE. Furthermore, while in the summer period there was a little bit less of a presence, it was determined at some point as in the late summer, early fall, it was determined that there was going to be a need for specialists to look into the logistical challenges that represents the distribution of millions of vaccines in a short order. At the time, it was anticipated that vaccines would arrive and we would be in position to distribute as early as January 1st. Of course, we now know that we were able, for a number of factors, a number of reasons, we have been able to really build in a very pragmatic and very deliberate way all the systems, build a national operations center for vaccine rollout, build a team at the agency with not only CAF members, also members from other departments and the agency to really look at all the facets of the distribution of vaccines.
All right, thank you very much. And with that, that brings our testimony for today to a close. I just want to congratulate our new clerk, Mr. Wasim Bouanani, who his first meeting helping us with the Defense Committee. So welcome to our new clerk. And also, I would really like to extend my personal thanks, the thanks of all the committee members and Canadians as a whole, to our very distinguished guest for all of the work that you have been doing and the difference you are making every day in the lives of Canadians. Thank you for your time today. We know how valuable it is, and we are all very grateful. And with that, meeting's adjourned.